Evening, everyone. Thank you for joining us this evening. We are giving this our second go. We really wanted to see you last Thursday, but then everything fell apart. Well, with the internet-wise in South Africa, isn't it? With the cables that somehow broke under the sea. But it is lovely to be with you this evening with our first meeting for this year. We have two guests. We decided to have Dr. Candice Royal back with us because we saw how very popular our meeting was last year, where we spoke about eczema and food allergies. So, Candice, thank you very much for joining us. Candice is a doctor here, a pediatrician here in Cape Town, in my neck of the woods, and a pediatrician with a special interest specializing in allergology. And that means everything that has to relate that is related to allergies and eczemas, food allergies, etc. And Candice, it's so lovely to have you this evening.
Thank you so much, Sarita.
And then we have Bronwyn, who is mom of Scout, a 4-year-old little girl, also here from Cape Town. So sorry, it's an all Cape Town event for you this evening. And she has really been through the ringer with her little girl who struggles with food allergies and eczema. Wonderful also is that she has an Instagram blog, which will be posted for you soon, where you would be able to follow her journey. And she offers wonderful, advice from her own experience, and posting some interesting and thoughtful ideas about lunch boxes and things like that moms very often struggle with and very often ask us about. Now, before we continue further, I would like to remind you and ask you to please pose all your questions, Instagram, Facebook, and YouTube, because we'll have time for Q&A, and we really want to be able to connect with all of you on those various sites. So, Candice, one of the commonest questions that I get as a dermatologist is, Doctor, I have eczema. So what am I allergic to? Or my son, my daughter has eczema. What are they allergic to? And how do you approach that? What would your approach be to those type of questions?
Thanks, Sarita. I think as an allergist, the people that come to see me also come in with the same questions. But I think let's go right back to the beginning and actually just chat about what is eczema in itself. So the analogy that you and I both use often in our talks and even to our patients is that if you think about eczema, you need to imagine that your skin is your defensive barrier against your external environment, and it's also supposed to be the mechanism by which you keep all the good things in your skin, so the moisture that you require to have a healthy skin inside. And when you have eczema, what you're missing is kind of those supporting structures between your skin cells and the nice oily layer that you can think of as the plaster on a brick wall. So you have a defensive barrier that's not functioning well. So when that's the case, what happens is it's so easy for all those irritants and allergens to penetrate the skin, the wrong microorganisms, because we all have microorganisms that live on our skin. That's normal, but the wrong ones tend to take control when you have eczema. And then, of course, it's very easy for the moisture in your skin to be lost to the external environment. So that's really what eczema is all about. So why do you have this defensive problem, this barrier dysfunction? That's really the term we like to bandy around when we talk about eczema. This barrier dysfunction, why does it occur? We know that it's largely a genetic problem. So it might not necessarily be that people in your family have eczema, but they might have hay fever or asthma, because all of those conditions are actually linked by various mechanisms and usually to do with your immune system. And then that is passed down through generations. So it may manifest in different disorders, but it has that genetic link. We also know that there are many factors like living in a world that's too clean, not being exposed to normal bugs and farm animals, and the foods that we eat, or being born by cesarean section. All of those factors play out in this genetic predisposition, and we end up with children with eczema, with this barrier dysfunction of the skin. So how does that relate to food? So I think the first thing to acknowledge is that families, and I'm sure there are families on this chat that have already walked a very long road with children with eczema, and I'm sure Bronwyn's going to tell us about that with her journey with her own children. Eczema is a difficult condition. Children are uncomfortable, they're itchy. So when you have this barrier dysfunction, things irritate your skin very, very easily, and that can be simple things like heat and sweat, or just not even wearing cotton clothing, synthetic things, tags in the back of your shirt. These can all irritate your skin very easily. And even when you don't see a rash, if you've got eczema, remember the whole skin has the problem, the barrier dysfunction. So even when you don't see a rash, you can be itchy. When you see a rash, you're quite far in the process of inflammation. So it's really a nightmare for families that have children with more severe eczema. How does that relate to food? So the problem with the relationship between food and eczema is that in most cases, it's not the food that causes the eczema. It's all those things I've just mentioned: genetics, your environment, being too clean, wrong microorganisms growing on your skin. That's what causes the eczema. But once that skin barrier dysfunction is established, we tend to meet food through our skin instead of through our gut first. And your skin is not supposed to encounter food for the first time. Remember, your immune system has to go to school. So when you're born, you have a very naive immune system. It doesn't know what it's supposed to fight or what it's supposed to tolerate. It's got to learn. So when you meet food through your skin, unfortunately, that can often set up the wrong pathway where your immune system thinks this is foe, not friend. Whereas if you meet food through your gut first, when you ingest food and meet that allergen for the first time, that means immunity of your gut is created to tolerate food. So that's where the problem comes in. So children with eczema, especially children with early onset, and by early onset, I mean before 6 months of life, especially those with the more moderate, more diffuse kind of picture eczema, are much more at risk of having a food allergy compared to the general population. So that, I'm going to say it again through this chat, because that must be the key take-home message. If you have early onset eczema, you're at risk of having a food allergy. Does eczema relate to a food allergy? Is it caused by a food allergy? In most cases, no, because the eczema came first. There are, having said that, a minority of patients that may have eczema that is propagated, shall we say. So it's continued by being exposed to a certain food, but it's a minority group of patients. And in that case, it looks a little bit different. So the eczema the food allergy that we're talking about that's caused by having eczema is the typical, the immediate type food allergy. You eat the food, you get a reaction. You have a peanut, you get a swollen lip, you have hives, you have difficulty breathing, and that can go on to anaphylaxis. Whereas atopic dermatitis, eczema, that's caused by food, tends to be a more delayed kind of reaction. So 24 to 72 hours. So it's harder to pick up the temporal association between the food and the eczema. And the only way that we can prove that is by an elimination diet. But I just want to reiterate, it is a minority group of patients with eczema that doesn't respond to typical treatment, that's maybe more severe, that has a different pattern. Those are the groups we would target for eliminating food. It's not the majority.
So, Candice,
yes.
so Candice, you're saying basically that if I had a baby now that has eczema, then it's not, I should not jump to eliminating foods immediately. So I shouldn't change the milk as soon as baby gets a rash, for example.
Absolutely, Sarita. And the reason for that is twofold. Number one, it's probably not going to make a difference because, as I said, the food is not the cause. And number two, when we eliminate foods from children with eczema, we actually put them at risk for going on to develop a food allergy.
Oh.
So I'm sure many people have heard that early introduction of allergens is preventative for food allergies. So we want to actually get babies exposed to the allergenic foods early in life to prevent food allergy. So if you take a child that's already at risk, but just by the sense that they have eczema, and you exclude an allergenic food, you could actually cause a food allergy. And I've seen that in many, many circumstances.
Thank you.
But maybe let's
And
sorry,
Candice, we have that delay that we're dealing with, aren't we? So yes, we're moving on to you're going to chat with Bronwyn now, I understand.
Yes, so Bronwyn and I met each other when her now 4-year-old daughter was just 10 months old. But I think Bronwyn, you'd already had a journey with eczema by the time we met each other. Perhaps you want to tell us about Scout's eczema.
Yes, thank you, Candice. So with Scout, when she was little, I think maybe around 2-3 months of age, we started noticing that she had a red ring around her eyes. So the skin would become quite red, quite irritated, and it would turn dry and become quite flaky. And then in time, it developed that it would sit on a cheek and it would develop into a rash around her mouth, etc. And so we kept noticing it, and you try different creams, you keep moisturizing, etc. And so didn't think much of it, just thought that her skin was a little bit more sensitive, and chatted to a paediatrician about it, and she said to monitor it. And then when Scout was around 7 months old, when we discovered the food allergies, it was then that her pediatrician said, I think that this was eczema to start off with. And so obviously that link came later on. So with Scout, she was reacting to her allergens via my breast milk, because at the time I obviously didn't know. And I think that in her case particularly, it was a little bit more aggravated by it. When we initially cut out the allergens, it didn't make that much of a difference to her eczema. And it's only when we really fully understood how her allergens and her skin were sort of interacting with each other in time, her eczema began to clear. And I think she was maybe closer to 18 months when her eczema stopped being something that we really needed to take care of. So I think that in that time, we just became really aware, because later on, I noticed that around her wrists and in her elbow, that's where her skin would also become quite moist, and it would turn red, and it would sometimes become flaky. And so what we then began to do was to just really pay attention, like you mentioned, Candice, to the types of clothing we were buying. So we stayed away from synthetic clothing, and it did help and make a difference. And we just made sure that the fabric of the clothing that we were buying was quite breathable. So I think that helped as well.
Great. You mentioned moisturizers, so maybe you want to just, for the greater audience, just speak about the role of moisturizers in eczema. As I've mentioned, it's a skin barrier problem, and moisturizers represent the way in which we can put the good stuff back into the skin. How did you find you needed to moisturize scalp skin?
So I was actually at one of our appointments with you, that you introduced us to a brand that eventually helped quite a lot. And it's a brand that we still use today when we notice that there's a bit of cracking in the skin, etc. So I think that finding the right moisturizer for the particular skin is so, so important. And I have found that it's trial and error. So it's really good to speak to a pediatrician or to speak to an allergist who understands what to recommend. But the moisturizer plays a very big role in just repairing the skin's barrier, and plays a big role in adding that moisture back into the skin so that it doesn't continue to be irritated. And I found that if we noticed that her skin was irritated and we left it for a day or two, then it would flare up quite a bit. But if we responded quickly with the moisturizer, often we could prevent that from happening. And that helped us to almost prevent that discomfort, because, I mean, she's little, she couldn't scratch at the time, etc. So she would become quite cranky. So if we just responded quickly, it really helped. And I think what I've learned is that you almost have to be patient. Sometimes it's trial and error. You give something a go, and it maybe doesn't work for your child's skin, and then you go back. But I think it's always just keeping notes, continuously communicating with your doctor, your pediatrician, your allergist, so that you can find out what works for your child.
Absolutely. And I always say to parents of children with eczema, it's a long road, right? But the good news is babies tend to have this more diffuse, extensive, acute kind of, like you said, red and weepy eczema. But as they get older, it tends to become more limited. So it tends to favor the joints. And most children, by the time they get to preschool, are looking a lot better. Having said that, we can't deny how itching in a baby affects the whole family. And the same goes true for a toddler or a child. Bronwyn, I know you never had to wet wrap scalp, am I correct?
I never had to, no, fortunately.
Yes. So wet wrapping, and I know that the Allergy Foundation has some information on that in their website, but it's an incredibly powerful tool in treating children with eczema, especially when it's more diffuse, or you're just not getting on top of it with your moisturizer alone. And the principle is to have your baby nicely washed and then apply your moisturizer, and then have a wet layer against their skin, and then a dry layer on top of that to provide occlusion, so that your skin overnight, as they sleep, can actually absorb the moisture from the wet layer and alleviate the itch. It's incredibly soothing, and it's a great method of being able to manage eczema. So I think we're going to post up about what AFSA has designed, the Kiddie Calmware, which is especially designed to make wet wrapping easy for you. But having said that, one can use bandages or even just tight-fitting clothing. But please have a look at that. If you have a little one with eczema, it sounds strange, but it's an incredibly effective tool. The child won't get sick, they won't get cold. It's a bit like having a wetsuit on. The moment you warm it up to your body temperature, they stay nice and snug, and it alleviates itching and provides a barrier against scratching. So it's a fantastic tool to add to your eczema armamentarium.
Candice and Bronwyn, thank you so much for sharing all of that. Bronwyn, and specifically also for sharing your story, sharing Scout's story, because it's going to help so many of our AD sufferers, our eczema sufferers that are joining us on all of these support groups. And I just also wanted to reiterate what you said, Candice. When I see my eczema patients, then I always tell them that we are going to see each other quite a few times, and we should really get to know each other quite well, because it's not just a quick fix. People are so surprised when they see the severe cases of eczema, because what we have in our minds as eczema is that little bit of a rash here and there that kids outgrow immediately. And that's why the general population actually completely underestimate how severe atopic eczema can be. And then they start searching for strange causes and immediately jumping to allergies, or immediately jumping to that they change their washing powder or something like that. They want to use that to try and pin the specific skin rash on. But Candice, maybe you can tell us a little bit on how would one know that they have a food allergy? When would they think about that?
That's great, Sarita. So I think, given that this is a food allergy session related to eczema, I think the first point to go to is that there are different types of food allergies. So we get, as I mentioned, the immediate type of food allergy, which Scout has, where you eat the food and you develop symptoms quite quickly. We say within 2 hours, but often it's minutes, and you develop the food. So if you see that your child eats a food and gets vomiting, a skin rash, swelling, change in behavior, rubbing eyes, itchy nose, difficulty breathing, then definitely consider that they might have an immediate type of food allergy. And that's not dose dependent. So often even trace amounts of foods can cause those symptoms. And I think Ron is going to tell us a bit more about that in her journey a little bit later on. And then we get this other, actually rather large group of food allergies that we call delayed type allergies. So these are a little bit trickier to pick up because you eat the food and the symptoms come on later. So in eczema, and remember, again, I just have to reiterate, this is a minority group whose eczema is aggravated by foods. But they'll eat the food and might be a day or 2 days before the eczema flares. So it's harder to actually link those. But the majority of delayed type food allergies actually involve your gastrointestinal symptoms. So that can be babies that have severe reflux or severe colic, or maybe blood in their stools and mucousy, bloody poos, because of allergens that they're ingesting. And it's a little bit harder to tease this out, but should your child experience any of those symptoms, it's really important that they see someone who understands food allergy and that can help you and support you as best as possible.
Yeah, we actually already have quite a few questions, and I'd like to thank the audience for that, and also just remind people to please pose their questions. We have a few comments that are directly related to our food allergy talk that we have today, and then we have some who are directed mostly at eczema itself that has no association with foods, which is the majority of cases, like we said. Hey, Candice. So it's only a small group of people. So please remember that the small group of people that are where their eczema is actually associated to food allergies, and that is very much so, or more so, let's say much more so in children that we see that. In adults, we don't really see that. So, although of course there's always here and there's always someone who will of course or will swear that it is due to a specific food allergy that they suddenly developed eczema. So maybe we can move on to a few questions now. And the first one I see here is from Facebook, and that's MC that posted here for us. So why did my eczema only start when I turned 40 years old? That's a fabulous question. Thank you, MC. That is unfortunately, or let's say, if you remember what I said earlier, people always have this in their minds that eczema is something that only kids get, that is only a little spot here or there, maybe little spots on the cheeks or spots at the elbows, for example. And that this is not something that adults should have. But we do know that there are various types of atopic eczema, which is the genetic form of eczema that we're actually talking about today, that can only appear for the first time at a later stage. In fact, we know that there are even people over the age of 60 that develop it for the first time. So if you develop eczema at the age of 40, it may be a little bit strange, you would think, but it's actually something that we see so many times now. Or as a dermatologist, I obviously see that quite a lot. And so there are various triggers for that. It's something that just came out at that stage in your life. And then we, rather than be searching for causes and exhausting your medical aid or exhausting all of your funds, it's really very important to treat it. And it really is or let's say, I don't want to say it's as simple as using the correct moisturizers, but as Bronwyn said to us earlier as well, that as soon as she starts using her moisturizers, the correct moisturizers, the ones that aren't perfumed, the ones that doesn't have a beautiful pink color, for example. So as soon as we start using the correct moisturizers, as soon as we start avoiding soaps that foam, then the eczema will already start to improve. It may not be enough for everyone. Unfortunately, in some cases, you will need a prescription cream, whether it's a cortisone, a steroid cream, or whether it's one of our other non-steroid prescription creams. Some people will need that, but the very, very important point that the eczema treatment is based on is always to avoid soaps that foam and to use lots and lots and lots of moisturizers. And with those moisturizers, I also want to say that it's important to find the right one, that Bronwyn said, but it's also important to realize that it changes. Your skin's requirements change from year to year, from season to season. So it may be that the moisturizer you know that you were using was working for you at that stage, but it won't work for you next year. And you have to cycle through various types of moisturizers, for example. I think let's move on to one here. 17-year-old Facebook comment with eczema, legs, elbows, off the chart, allergies to dusts, pet dander and grasses. And I've tried creams, cortisone, etc. And then this mom asks whether sugar triggers eczema, whether sugar has any association with eczema. Candice, that's something that I'll definitely leave to you.
Thanks, Sarita. So I think the first thing to say is if you're not winning with your current treatment plan with eczema, you need to push through. And we've chatted about that a lot, Sarita. There's absolutely no reason to accept having extreme eczema. There is absolutely different treatment modalities than just creams and steroids. And if you're not winning, then you need to find another, push your specialist or find another specialist who has an interest in eczema to help you explore those other options of treatment. And we're very excited that more and more newer, very wonderful but very expensive treatments are coming into the country. And those do need to be advocated for our patients. So if you really are struggling, reach out more. We're looking for eczema advocates to help us get funding for these different treatments. So does sugar trigger eczema? I think I get asked that pretty much daily. First thing to say is sugar for children obviously it's just not good. But it's not an allergen, it's a carbohydrate. So you can only be allergic to, in the most part, you can only be allergic to protein in a food, not a carbohydrate. Sugars are naturally occurring carbohydrates. So no, you can't use that excuse for telling your kitty to not have that lollipop. It's not the trigger for the eczema. In a minority, again, it's a minority group of kitties, preservatives and colorants and those kinds of things, which are all nasty for children, might be aggravating eczema. So that might be the association that you're picking up with, but it's not the sugar.
Mm-hmm. Yes, Candice, and you were referring to doctors who have a specific interest in eczema as well. And a list of those doctors you can find on the Allergy Foundation of South Africa's website, as well as on the Dermatology Society of South Africa's website. So yes, you don't have to suffer, and there are treatments available, and that actually leads me on to the next question here, from YouTube. Zizikaze asked, what is the best way to deal with eczema when an adult or she seems to be she's an adult, and she has been using steroids for years, and her eczema is not going away. So yes, unfortunately, if you remember what I said earlier, we do have atopic eczema cases that just unfortunately persist. But there are treatments for that. And it's very important to push your doctor, your healthcare provider, whether you're at a day hospital or whether you're at a local clinic, a GP, whether at a pediatrician. It's very important to make sure that you request a referral to a doctor that has a specific interest in eczema. Because eczema treatment or let's say management, I like to say management because unfortunately it's not something that we can cure at this stage yet. It's something that we need to find. We need to manage with you. We need to find a management plan that works with you, and that is very important to make sure that that we try and find the right answer for you. Yes, Candice, I don't know if you had anything to add there.
No, absolutely, I agree. And also to remember that AFSA has a atopic dermatitis support group, so that can also be a really great resource to join. I just saw this really great comment from Instagram where someone says, my daughter reacts to peanut butter and eggs. Should I continue giving her those foods even though she's reacting? And that's another question that I meet quite frequently. Absolutely not is the answer. So I think there's a lot of, and I'm going to ask Bronwyn about some sort of barriers and myths she'd like to dispel. But the idea that giving a food that a child is reacting to, probably having a mild reaction to, will help cure the allergy is not a good idea in a home environment, because allergies are unpredictable. Food allergies are unpredictable. Just because you got a rash on the one day doesn't mean the reaction's going to look the same on the next day. And remember, these can be life-threatening reactions, so you don't want to be testing the waters with that kind of food reaction. So absolutely do not give the food. Rather get help, get testing done, and get advice from someone who's familiar in the management of food allergies.
Candice, there's an interesting question here. Is there a link between childhood eczema and developing food allergies later in life?
Yeah, so that I also spotted that question. It's a great one, because the food allergy that Kelly is referring to is LPT, which most people won't know about. It's a stone fruit food allergy. which falls under the kind of allergy that we call oral allergy syndrome or pollen food syndrome. So it develops later in life, usually teenagers and adults. And the root of the problem is because you have hay fever or allergic rhinitis to a certain pollen, which then starts to cross-react with the stone fruits. So stone fruits like plums and peaches and that. So when you start eating those fruits, you get often tingling in your mouth, maybe swelling of your lip, itching of your palate. Is that related to eczema? So we always think of eczema as kind of starting blocks of any kind of allergy disease. So children who have eczema are more at risk of being sensitized to environmental allergens like pollen, which then later can cause pollen food syndrome. So I would say, yes, eczema is a risk factor. It's not the direct cause. The direct cause is having allergic rhinitis to a pollen, which then begins to cross-react with certain foods. But yes, they definitely may have a link. I hope that's answered the question.
Thank you for that. You see how complicated food allergies and eczema is. It really is, and that's why we work hand in hand with our allergy specialists. Dermatologists work hand in hand with our allergology or allergist. It's difficult. I know some people say allergist, some people say allergologist, but we work hand in hand with our allergy specialists on this very complex on these topic. Someone asks here, does low iron and vitamin D have an effect on eczema? And it's an interesting one. And I know that there's a lot of speculation about that. Candice, I'm not sure what your thoughts are on it. What I have is that there's not enough evidence to say in the literature that it definitely plays a role. A low vitamin D and a low iron is never good for someone. But it's certainly not something that is necessarily associated with eczema. So that is what I got from the literature, but I definitely stand to be corrected.
So I agree with you, Sarita, 100%. There's no good data to tell us to supplement people with eczema with iron or vitamin D. There's been a lot more interest in vitamin D because of its role in the immune system, and obviously eczema is strongly related to your immune system. We don't have data to confirm that supplementing with vitamin D will necessarily fix eczema, but definitely if vitamin D is low, that should be addressed because it's an important component of your immune functioning.
Thank you for that. I think we're going to take a break here. There are so many questions pouring in, and we'll try to get to everyone. We'll try to leave enough time for Q&A at the end. But yes, I once again want to reiterate, emphasize what Candice said about the support groups. We're on Instagram and we're on Facebook, and we haven't moved on to other types of social media platforms yet. It's too much, but we definitely try to touch base with you on these social media platforms. Just remember that we can't diagnose and treat with prescription medications on these platforms. We do our best to refer you to the appropriate professionals in your area. And then also, once again, as a reminder, we can see there are links to the allergy professionals support group, the wet wraps, and the society approved, the Allergy Foundation's approved products, moisturizers, and soap substitutes that we can find on AFSA's website. So maybe you can grab a drink quickly. We'll just be about 2 minutes and then we'll be back with you. So we just need to also take a sip of water or coffee or whatever we're having this evening. So we'll see you shortly.
Skin dryness is a common issue that can affect us all, regardless of age, gender, or skin color. It's associated with skin discomfort, tightness, urge to itch, Scaly patches. Whether it's dryness visible to the naked eye or an established diagnosis such as eczema, it can really impact quality of life. Daily life factors, as well as skin conditions, can alter the skin barrier function. Bioderma expertise is based on ecobiology principles, a deeply respectful approach that considers the global skin ecosystem. Thus, it finds its inspiration in the skin's inner properties and mechanisms to conceive the Atoderm range to address skin dryness for all skin types at every stage of life, providing the skin the essential lipids it needs. Atoderm, a comprehensive range to bring back softness and comfort to the skin, restore the skin barrier in a sustainable way, regain physical well-being and peace of mind. Atoderm, the daily life changer for people with dry and eczema-prone skin.
Welcome back. I hope you're refreshed. We have another 20 minutes or so left together. And I just want to remind you, please, we still have a little bit of time for Q&A. So for having a look at your questions. So remember to pose them. We have some interesting ones in the chat box, I see. And yes, so Candice, maybe I can hand over to you.
Thanks, Sarita. I think the next person we really want to speak to is Bronwyn to tell us all about Scout's food allergies and her journey with that. We've heard about how you've managed with eczema, but how did you realize that Scout had food allergies, and how has your journey looked there?
So initially, when Scout was really little, she had what we thought at the time was baby acne. You know, when they're really little, they're about 3-4 weeks old, and sometimes they break out those spots on their faces. And my pediatrician suggested to cut out peanut butter at that stage because I was having peanut butter sandwiches quite regularly, and that helped a little bit. And it went away and it cleared, and then obviously we dealt with some of the eczema things, but the big moment when we realized that food allergies were at play was when she was around 7 months old, and we introduced scrambled egg. And within minutes, I said to my husband, wait, something's not right, because her chin started going red and we started noticing hives. And eventually her face began to swell. So she was red, she had the hives, and we got in the car because the hospital's quite close to us, and we began to drive. And eventually her eyes began to swell, and the one actually swelled shut. So we got to the hospital, they treated her, and we were told that she probably has food allergies. And then we went and we saw our pediatrician, and she did the blood tests. And that's when her peanut allergy showed up, as well as a milk allergy. The egg allergy, it was shown that she's allergic to both egg white and egg yellow. And then from that point on, we were referred to you, Candice, and we saw you at around 10 months. And that's when we did the skin prick tests. And so the skin prick test, so from what I understand, the blood test shows only a certain amount of allergens. I think it's 6, if I'm correct. And then after that, so we started doing the skin prick tests, and that's when we picked up that she was allergic to all nuts. And the almond and the macadamia and the hazelnut showed up quite profoundly. And then from that point on, so we eliminated those foods. So that question that came through earlier about giving the allergens, if we had to continue to give Scout those allergens, she could have had an anaphylactic response, because that's what our tests with the peanut in particularly showed up, that she's likely to have an anaphylactic response to peanuts. So from that point on, I remember she was close to, it was about a month later, I said to you, listen, so I had to cut out those allergens from my diet because I was breastfeeding, and she was responding. So she's quite highly allergic to the eggs and the peanuts. So the moment I cut that out, her she began to improve. So the constant, I remember her nose was always blocked and her chest was always quite wheezy. And when I began to cut out those allergens from my diet, that went away. And then I remember showing up to your office with a long list and we picked up then strawberries, avocados, bananas, sesame seeds, and the list was just so long. And it was at that stage that I decided to stop breastfeeding. We had also seen a dietitian in that time, and she'd been put on to formula that is specially formulated for children with cow's milk protein allergies. And we proceeded to follow that diet. But that's when so I was almost quite frozen by all of it, because at the time I didn't have anybody to really speak to about the day-to-day living. You know, you go and you see your professional and they say, these are the things you've got to avoid. These are some of the things that you can do. But you still have to go to family gatherings and you still have to go to parties. And eventually she still needed to start school. So I was almost frozen, because I was trying to find substitutes, and then being so nervous that the substitute was going to cause reaction as well. One of the big things that I had to learn to do, which I think is so important if your child's got food allergies, is to learn to read food packaging properly. And these days, we're very fortunate that the allergens are listed on the food packaging. But what I notice is that sometimes not all places that produce food are as careful. So you really have to learn to read your actual ingredients as well as checking the allergens. So that's something that's very important. So we had to read food labels, we had to find substitutes. And I think that one of the things that was quite challenging is finding substitutes, but making sure that you're not compromising on nutrition, because she's still meant to be eating across food groups, etc. So I think that to a large extent, just managing life became really difficult. And then because of the peanut allergy that at one stage, unfortunately, it's gotten a lot better now, but she was allergic to, and she had an environmental allergy to peanuts. So if you walked into a room where somebody else was eating peanuts or eating peanut butter, she would begin to react and she would start coughing and her airways she would suffer, and she would start rubbing her eyes and it would go completely red and she would struggle. So we would then have to give her allergics. We would have to take her out of the environment, etc. So life was, to a large extent, it was quite stressful. In some ways it still is, because even though she doesn't have an environmental allergy at this stage, if somebody has touched eggs and put their hand on a surface and she goes and touches it and then rubs her eyes or eats something with that same hand, she still reacts. And the same is with peanuts as well. One of the nice things is that she's beginning to outgrow her cow's milk protein allergy. And that's been a journey. And so she can tolerate baked milk at this stage, which is really good. And at one stage with us, she could tolerate baked egg as well. But and so earlier you made a comment, Candice, that the reaction is not always going to be the same if you keep exposing your child to an allergen. And it made me also think about the fact that for a little while she could tolerate baked egg, and then her tolerance completely dropped and we couldn't give it anymore, because when we tried giving it on a few occasions, there was just constant vomiting and the reaction where she would just swell up and go red again. So you have to be so vigilant and you have to be so conscious and you have to be so aware, and you have to make sure that you've always, the moment you leave your home, you have to make sure that you've got your medication in case there is a reaction. So yeah, you always have to adjust your entire life around this individual to be able to manage those kinds of allergens. Yeah.
Thank you, Bronwyn. I think that was just a great account of your incredibly difficult journey with Scout and her food allergies. Obviously, Scout represents someone with multiple food allergies and also a trace reactor, which is the most difficult kind of scenario that we deal with. I just wanted to ask you, what are some of the barriers that you've encountered when dealing with other people and their understanding of food allergy? Are there any sort of myths you'd like to dispel?
I think that the biggest one is probably that a food allergy is not an intolerance and it is not a dietary preference. So when we ask for allergens not to be present, it's not because we are being overly cautious. It's because if she's put into that environment, the chances of her having a reaction is actually quite high. And we've actually had those things happen to us more than once. And I guess that kind of links to speaking about restaurants, restaurant owners and people who work in restaurants. There've been occasions where we've asked, does this contain, because I've become quite savvy with, you see chicken strips on a children's menu, you know that's likely to be dunked in egg first before it goes into the fryer. And you ask, is there egg in this, or does this contain nuts? We've had a dessert show up to the table with peanuts before. We've had dishes show up with pesto in it that often contains cashew nuts without it being disclosed on the menu. So I think that restaurants have to become really careful about fully disclosing when allergens are present. I think it's getting better in a lot of restaurants, but some don't understand the severity around it. So fully disclosing it, but then also if a waiter were to work in that restaurant, they really do need to know and understand that menu, because if someone asks, they need to be able to answer them fully. And then I guess it's just to remind people that allergies, especially when they are anaphylactic, they are life-threatening. And so my experience with people is almost been that you need to prove that it's serious. And they don't necessarily always take your word for it, because it's too much of an effort for them to check a menu, to check a party plan, to change a cake, etc., to be able to include the individual. So I think those are some of the things that I think are quite important to know.
And I think just to reiterate your point, and there's an excellent study that was done that showed that parents of a child with a food allergy have the same quality of life as parents of a child with type 1 diabetes. So really, it's a huge impact on your quality of life. And I think we must reiterate, it's not an intolerance. It doesn't mean it gives you a little bit of tummy pain if you have too much. It's a dose-independent, potentially life-threatening response to a food. So it's a very different scenario. And I think we as a community have so many people who like to blame symptoms on food that dilutes people that have a true food allergy.
Candice, thank you, Bronwyn and Candice, for sharing that. I got goose flesh, Bronwyn, when you told me your story. I think, really, I think if there's a prize, a prize for Mom of the Year, I think that definitely get it probably every year, because goodness gracious, to have to deal with that is, and you obviously you feel you're very worried about your child, and you also worried about the fact that your child doesn't have I don't want to say normal, but she can't go to birthday parties with her and share food with everyone. I mean, this reaction that she had, even just being in the room with someone with peanuts, and then also people kind of just laughing it off as nothing, and being crazy, like you said, or being completely over the top. That's really fantastic. Well done, and thank you for sharing that every day on your Instagram posts as well. Hey, I think that is going to help so many people. Candice, now let's move on to this question. Does eczema get better?
So I think you can comment on adult eczema better than I can, but from a childhood perspective, I always try and tell people the first year of life is going to be the hardest with your eczema journey. We know that the majority of children improve, and by the time they enter school-going age, 5 or 6, most are, if not resolved, are significantly better. And as I mentioned, they move from this diffuse acute type eczema to more the patches and the folds, which is still problematic, but maybe easier to deal with.
Yeah,
And-
no, I agree with you 100%.
Oh, sorry,
Sorry, Candice, we have a delay. You were saying?
No, I think the other thing to say is the more proactive and the better one manages eczema from the get-go, from the onset of a flare, the better your control will be and the better your prognosis is.
Getting back to what you said in the very beginning, why eczema happens because of that disrupted barrier. So your skin being almost like a sieve, I always like to think. And then if we replace it with good moisturizers, for example, then we're just starting to slowly recover that barrier so that we can try and keep the bad stuff out and the good stuff in. Right, so let's do a few more questions. We have here a nice one, I thought, Candice, from Tracy on Facebook. My son has food sensitivities. It seems as if I see a reaction a day or two after eating, for example, braaivleis, tomato sauce. And are there any types of tests that he can take that will give us a list of foods to avoid? I'm sure that you get all the time. Hey.
Yeah. So obviously a little bit difficult to answer that question without really understanding what you mean by a reaction, Tracy. If it's a flare of an eczema, one might actually just say don't do any tests at all, because it might just be eczema that does its flaring and improving and flaring and improving as part of what eczema is all about. If it's something that you do feel you can actually connect to a food, then absolutely go and get tested. Bronwyn mentioned her child had both blood tests and skin prick tests. Both are very accurate. They give us a great idea of allergy to a wide variety of foods. If one thinks a preservative might be the problem, I'm just mentioning that because of the reference to the tomato sauce. There's also blood tests that can be done to prove that correlation as well. So do test if you think that it is an allergy, but be very wary. There are a lot of false tests out there, and I think we as APSA need to say that there are a lot of unvalidated tests that are offered to try and prove food sensitivity. So we've got to be very careful about our terminology. Allergy is an abnormal immune response reaction to a food that should be tolerated. An intolerance or sensitivity is a different scenario, and there aren't validated tests out there to prove those. And often a wide variety of symptoms are blamed on a food, whereas the food is completely unrelated. I don't know what your
that's also, yeah, but that's also why it's so important to have these tests done by a specialist, I feel, Candice, because, if anyone can tick off an investigation on a blood form, but that is not, what do you do with those results? You can't, you need to be able to link the blood tests, for example, or the skin tests for that matter, because we can do skin tests at various pathology centers now as well. But we need to have this done under the supervision of a specialist that knows what to do with these results as well, to interpret these results. And I'd just like to, once again, Candice, Bronwyn, we actually had a comment here from someone who who was so grateful and saying, thanking you for sharing your experience, because I think it really touched people's hearts this evening. We have quite a few more questions, some of them not necessarily related to atopic eczema itself, but we will get to those questions. Candice, I'm not sure if there's anything that in the questions that you see that you would like to address. I think we've addressed, most of the ones I see here. But of course, you can still send your questions, and then we will still have a look at those questions. Now, we've actually come to the end of our hour, and it's been absolutely wonderful being with you again. Candice, it's always a pleasure having you, and you are sharing all your vast knowledge, and we can see that you care about your eczema patients, eczema and your food allergy patients. So we really thank you for that. And Bronwyn, thank you so much once again. I can't thank you enough, but it's just been absolutely wonderful to have you here this evening. We'd also like to thank Bioderma, who is one of our big sponsors this evening, as well as Sanofi. And then I would like to just remind you of our next meeting, which will be on the 13th of June. And we will be discussing the emotional impact of eczema at that meeting. And we'll hopefully get either a psychologist or a psychiatrist in, and then a patient sharing their experience as well. And it's been absolutely wonderful being with you this evening. You can continue posting your questions. If you're not a member of our Facebook or our Instagram support group yet, please join. And then we can grow the atopic dermatitis group. Then we can help each other on that. And because we all learn, I learn from my patients every day. And I have patients who've had this condition for 40 odd years, and they can share their experience with newer or people who are new to the condition. Thank you, Candice and Bronwyn. I don't know if you'd like to just say goodbye, give a wave.
Thank you for having me, Sarita and Candice.
Thank you, Bronwyn. We can't thank you enough for giving up your time and sharing your personal journey with Scout and also with your younger one. And thank you, Sarita, again for facilitating a great meeting. And please keep posting your questions. We are going to answer them. So post away.